Now coming to the trapping theory. In this trapping theory, most of the NSAIDs or NSAIDs or weak organic acids, and in gastric juice they are non-ionized and lipid soluble. And these NSAIDs diffuse across the gastric mucosal epithelial cells, epithelial cell membranes, and then into the cytoplasm, where the pH is neutral. And in the neutral pH, NSAIDs are converted into the re-ionized and relatively lipophobic form. It is lipophobic form, as we already know that our cell membrane is lipophilic, as it is made up of a phospholipid bilayer. As this NSAIDs are converted into the lipophobic form, it can't be escaped out again, and therefore this NSAIDs are trapped and accumulated within the cells, leading to the cellular injury. Okay. And coming to the another factor causing this peptic disease is the stress related mucosal damage. In this case, we have, due to stress, there is a reduced gastric blood flow, and then another one is the mucosal ischemia also occurs because of the, as stress causes the free radicals production, it damages the mucosa, and thus causing the mucosal apoptosis also occurs. And that's enough for this. And coming to the uncommon causes or Zollinger-Ellison syndrome. What is this Zollinger-Ellison syndrome? It is a rare condition in which one or more tumors from the pancreas or the upper part of the small intestine are occurring. And these tumors are also called as gastrinomas. And they secrete large amount of the gastrin, and which causes the stomach to produce more amount of acid. Secretes large amounts of hormone called gastrin, which causes stomach to produce too much of acid. And next coming to the part is radiation. This radiation causes the epithelial, this radiation damages the stem cells in the epithelium. Stem cells in the epithelium of the stomach, and thus causing, how is this affecting the stem cells? And because of this radiation, it is causing the apoptosis of the stem cells and causing the mucosal barrier breakdown. As there is no stem cells, no cells are being produced. As no cells are produced, no mucus layer is being formed, and the mucus barrier is being broken down because of this radiation. Okay, and with respect to the gastrointestinal tract, the severity of the toxicity is reported as grades of severity based on the symptoms. That is, because of the radiation, obviously there some damages occurs, and this should be categorized as grades. If the grade 1, based on the signs and symptoms, it is divided into the grades. That is, the grade 1, grade 2 until grade 4 based on signs and symptoms. If in the grade 1 and the grade 2, if the radiation injury are very frequent, and then the patient no need any treatment, they can be cured based on, they can be cured by themselves. Grade 1 and grade 2, no need any treatment. And coming to the grade 3 and grade 4, if the patient is suffering with GI bleed because of this radiation, then the patient needs the therapy. And next, coming to, apart from this, there are few drugs which causes the peptic ulcer disease. That is the potassium supplements. The potassium supplements, the potassium chloride in some of its solid form may be retained in a fixed location within the esophagus, resulting in esophageal hemorrhage. As it gets retained in a fixed location within the esophagus, resulting in esophageal hemorrhage. And it is thought that the esophageal hemorrhage is mainly because of the wax matrix of slow release tablets. And coming to the another cause is the smoking. The smoking interferes with the gastrointestinal mucosal protective mechanisms. Gastrointestinal mucosal protective mechanisms. Under normal conditions, a large amount of hydrochloric acid is being present in the stomach, which helps in the breakdown of the food into the smaller pieces and for the further digestion in the gastric tract. The gastric acid is being neutralized in the duodenum by the sodium bicarbonate produced by the pancreas. This is a normal thing which is happening. And the increased secretion of the acid or a decreased secretion of the sodium bicarbonate from the pancreas that can interfere with the protective mechanisms of the gastric mucosa. That is, this smoking can increase the acid production in the stomach and also reduces the sodium bicarbonate production from the pancreas. And another one it causes is pyloric valve damage. The pylorus is a one-way valve between the stomach and the duodenum that prevents the bile and the other contents of the small intestine going back into the stomach. What will this smoking do? This cigarette smoking induces the pyloric incompetence and then increases the duodenogastric reflex. And there is also one more thing which by which the smoking is causing is it produces the free radicals. In the cigarettes we have quinone or hydroquinone complex, which is capable of decreasing the molecular oxygen to produce peroxide, and then eventually transforming to hydrogen peroxide and hydroxyl radicals, indicating that smoking induced free radicals promote the gastric mucosal injury. For another one is coffee and alcohol. The both caffeinated and the decaffeinated coffee can increase the acid production, and alcoholic beverages, the coffee increase the acid production, and the alcohol causes the erode the protective mucosal lining along the gastrointestinal tract. And if they both gets damaged because of the coffee and alcohol, then what happens? There's a further inflammation and bleeding of the GI tract. Okay. And by this we have completed the causes, and next coming to the signs and symptoms. Signs and symptoms.